Today, doctors across the developing world have to make difficult choices when treating their patients. Access to therapies varies, and for a person with hemophilia, even a single serious bleeding episode in a joint can lead to permanent damage and chronic pain. Unfortunately, this situation is all too common worldwide. 1 in 1,000 people have a bleeding disorder. The vast majority live in areas where there's limited access to diagnosis and treatment, so they receive very little care, or none at all. Due to lack of treatment, people with severe hemophilia in developing countries often do not survive to adulthood. And if they do, they face a life of severe disability, isolation, and chronic pain. Biogen and Sobi are working with the World Federation of Hemophilia to create a sustainable model for humanitarian aid that has the potential to change the way humanitarian aid is delivered to the hemophilia community, enabling a predictable supply of treatments for emergency situations, acute bleeds, corrective surgeries, and also prophylaxis for young children. It's our goal to change the way aid is delivered to people with hemophilia worldwide. Biogen and Sobi have pledged to produce 1 billion international units of clotting factor therapy for humanitarian use, of which up to 500 million IUs will be donated to the WFH over the next 5 years. Delivery has already begun. The first shipments are now reaching people with hemophilia in 16 developing countries. This donation will effectively double the amount of factor available through the WFH's Humanitarian Aid Program in 2015. By 2017, it will quadruple it, setting the global bleeding disorders community on the path for a predictable, sustained humanitarian supply of treatment for those most in need. This donation is an important step, but for lasting change to become a reality, it will require an expansion of our collective efforts among companies, countries, and the global hemophilia community. Together, we have the potential to transform the humanitarian aid model. Join us and share our vision that all across the world, people with hemophilia can live full lives, regardless of where they live.